In fact, the recording has already begun.
Good morning, everyone. It's a pleasure to be here with you all today. I want to take a moment to recognize your outstanding work you do in Kentucky's healthcare sector. You're the backbone of our communities, tirelessly providing care while managing the numerous challenges that come your way. I truly appreciate your dedication and commitment to making the difference in people's lives. As the Deputy Commissioner of the Department of Workforce Development, I'm excited to be with you today. I know firsthand how tough it is to attract talent and retain qualified healthcare professionals in today's fast-paced environment. Finding individuals who possess the right skills and demonstrate a genuine commitment to the work can be a very daunting task and act as a game changer for your organizations. We're here today to talk about Ready for Industry. It isn't just another training program. It's a community effort aimed at equipping Kentuckians with all the skills and certifications that are in high demand by employers like each of you. Think of it as a bridge that connects eager job seekers to the specific needs in the healthcare industry. Today, we're going to dive into how Ready for Industry can directly benefit you as employers of the Commonwealth. We'll talk about targeted skill development and how the program helps essential foundation skills, problem solving, teamwork, effective communication, and workplace safety, which are necessary for anyone pursuing a career in healthcare, whether they work directly with patients or handling administrative tasks. We're going to show you customizable training and its flexibility to help the healthcare industry. Ready for Industry is a pipeline tool for qualified candidates. It helps improve retention, strengthen Kentucky communities at the heart. I wholeheartedly encourage you to explore how Ready for Industry program can play an essential role in workforce development. Together, we can build a stronger, more skilled healthcare workforce. Our team would love to connect with you, answer questions, and provide resources you need to get started. So please don't hesitate to reach out to us after the webinar. Thank you again for being here. We're excited to share this resource with you. And Josh, I'll turn it back over to you.
Wonderful. Thank you so much. So we're excited to share Ready for Industry. As Michelle said, this is a resource that is fully funded across the state. There is a QR code to get this for yourself right there and use it. And over the course of this webinar, where Dr. Casey Alvarado, our director for Ready for Industry, goes over some slides along with myself, you'll understand how you could use this in your industry and with to build the pipeline, right? At the end of the session, we will have a panel discussion with Bill, Lisa, Debbie, and Michelle talking about the healthcare industry and how this can apply. Dr. Alvarado, why don't you take it away for us?
Hi, good morning, everyone. Thank you all for being here. Thank you, Deputy Commissioner Michelle DeJean and her team for not only setting up these webinars so that we can get this information to each of these sectors, but also coming alongside us and partnering and putting in and with the Quest grant, and so that can be fully funded resource for you to use in your organization, as well as with partnering organization to help strengthen your workforce. As Josh has he said, I'm Dr. Casey Alvarado. I've worked in workforce development for the past 15 years in various fields, from public education, private education to government. And what RFI is doing is meeting a great need in workplace knowledge. And so let's get into it. I will do a really good, just a note of good housekeeping. If you guys have any questions, if you'd like to put them in the chat, Josh will be manning that chat, as well as Ms. Schuyler, so that I can answer any questions that you may have. And again, this is a presentation, but also a discussion. So if you have questions, please feel free to throw up that hand and stop me in the middle so that I can answer that for you. Thank you all so much. Right. So as I mentioned, Ready for Industry is a fully funded program by the Quest, the Quality Jobs Equity Strategy and Training Grant, as an investment into workforce for business and industry. Ready for Industry prepares job seekers from late teens to adults with career awareness and career preparedness. It's bridging the gap of knowledge that maybe they didn't get quite in the classroom or quite as they moved on to that real world application, or maybe in their reentry, they weren't exposed to those areas. So imagine if you were able to sit down with someone who was doing the dream job that you wanted to do and ask them all the questions that you wanted to ask. What's your pathway? What does your day-to-day look like? What is the terminology that's used? Here's this opportunity to sit down and learn in healthcare, manufacturing, information technology, construction, and logistics to get that workplace knowledge to help you to be a really skilled trainee ready for the job on day one. So as I mentioned, how it works is a new job seeker can identify a career pathway, and this when we're looking at healthcare, and they'll look at the different aspects of that. What is the most in demand aspect of healthcare? Are we looking at medical assistants? Are we looking at CNAs? Are we looking at some kind of X-ray tech or diagnostic? We're looking at what are the living wages that are available in there. It helps again give more of an understanding, a more day-to-day of what that person will experience, what those x-rays, how they'll conduct themselves with patients, paperwork they would be fill out, documentation, terminology that they would be using. And then how do I get into this? What's the general education do I need? Do I need to be in a certificate program, or do I need to go to a technical school or a community college? Do I need to step into a 4-year? And also at the timing that it's going to take me to do those things. In addition to that, it gets into the basics of safety and privacy and security issues, things that we want to address, especially as someone who's been through maybe some career training and they step into the job that maybe they've forgotten. We can go over those things again so that we can make sure that they have the most safe environment on day one. How this curriculum was created. This was created originally by the developers of WorkKeys. So if you're familiar with ACT WorkKeys, this is the same people that created that. What it wants to do in this curriculum is address the workplace competencies, the industry-wide techs, and the industry sectors. So that's in those 3, 4, and 5 of that pyramid, and bridging that knowledge from academic until we actually step day one onto that job. So again, someone is not stepping there and they're a novice, but they're at least feel confident in the job that they're ready to step into, as well as confident in learning and helping bridge that gap to increase or decrease that onboarding time.
Casey, can I make a comment
Yeah, go
here? The creators of Ready for Industry were the founder was also the board chair of Erlanger Hospital System. So deeply familiar with healthcare practices across the systems, the needs, and really the writers of this were people that work in healthcare, understand some of these needs. So we're trying to provide a day one employee or new hire or inspiration for people looking to join the workforce on the opportunities that exist, and really build on those academic competencies and take it one step further so they're ready for industry, in this case, ready for healthcare. Thank
you for that, Jobs. As well as Miss Page was involved in building this competency model, and so I'm pretty sure she can speak to some additionals if there's something that you would like to add to that, Miss Page.
Lisa, we can't hear you. We see you talking, but the audio is not working strangely enough.
All right, let me figure that out.
There you go.
There we go.
Yeah. Oh, okay. I was just going to say thank you for that. Yes, this competency model has been around for, I don't want to date myself, but for a few decades, and also works for other industry sectors as well. And I think what is very important with this particular model is just the identification of those competencies, but the personal effectiveness, academic, and workplace, specifically identified by, as you were saying, Josh, subject matter experts in the industry. And particularly today, as we're talking about healthcare and focused on that sector, it's really important to know the involvement of the subject matter experts in identifying what is necessary for the competency programs. So it's a model that's been around for a long time, has been used and supports the different credential pathways and the stackable credentials that can be attained. So thank you.
And this was used in the design of Ready for Industry to try and really identify what is the gap between academic and workplace and industry, right? And trying to, as you said, use subject matter experts to make that happen. So thank you so much.
And to add to the benefits of the program, Dr. Alvarado and Josh, is also as employers who are joining us today to consider upskilling your existing workforce. So Ready for Industry is also available to employers at no cost as well. So that's why we're hosting these webinars, spreading the word, this invaluable tool and resource to help employers meet their workforce goals. Thank you.
Thank you. Exactly.
Thank you all. And I will identify that piece when we get into the section. So please don't let me skip that so that we can show also how employers can use pieces of the curriculum in their onboarding. Okay. So.
Have you ever thought about working in healthcare? A career in the healthcare industry is both challenging and rewarding. Healthcare professionals care for patients by promoting good health, treating illnesses or injuries, and managing their recovery. Through this, healthcare workers fulfill a variety of roles in a patient's treatments, from birth all the way to keeping them safe and comfortable in their end-of-life care. This Ready for Industry course will explore jobs in healthcare and many of the common terms and procedures you will encounter working in this field. With so many different types of healthcare jobs, many of these careers may be unfamiliar. This course will help you consider which ones might appeal to you. You'll also explore the career outlook for healthcare jobs in your area and learn how to get the necessary training for a career. After taking this course, you should be prepared to move forward into many different job opportunities that can provide you with a rewarding career. In this course, you'll become familiar with the wide variety of different places that healthcare professionals work, the language used to describe the parts of the human body, common diseases and illnesses, and medical procedures, issues in protecting patients and staff from infections and medical errors, patient healthcare and privacy rights, current issues in healthcare policy, such as insurance and the availability of healthcare to all citizens, and new trends in healthcare, such as telemedicine. Some of the jobs that this course will examine include nursing. If you enjoy working closely with people in providing healthcare services, nursing might be the career for you. Nurses support the work of physicians and perform physical exams, obtain health histories, and provide patients with health promotion, counseling, and education. Pharmacy. A career in pharmaceutical science allows you to help patients use the medicines prescribed by their doctors to cure illnesses and alleviate symptoms. Pharmaceutical science is a broad career field with many different career paths and levels of training. Clinical and diagnostic sciences. You may be interested in becoming one of the highly trained individuals providing the crucial data doctors need to make the correct diagnosis and provide effective treatment for a patient. Hospital labs have a strong demand for professionals such as phlebotomists, medical lab technicians, radiologic or MRI technologists, cardiovascular technicians, and medical technologists. Emergency medical services. Perhaps you wish to become an EMT or paramedic and take your life-saving skills to the site of the emergency. EMTs and paramedics provide rapid emergency medical care for the sick and injured under the direction of a licensed physician. Emergency medical services careers are in high demand and can be an exciting career. Home health and hospice. Perhaps you're interested in home health and hospice careers, which focus on compassionate care to patients confined to a home or are near the end of their lives. Home health care may be therapeutic both physically and psychologically.
So as you can see from this video, you can see a wide range of exposure to healthcare pathways that were within the platform. What I also wanted you to see is how the platform laid out to see that you have voice to text. There is a lot of reading in there, but we definitely know that that is a competency that everyone is needing is to increase those literacy levels. right as we're in this, before we jump over to the next slide, I kind of want to see, is there any ideas or thoughts as someone is looking at this and how they can use this in their company or in their organization? If you want to just throw that in the chat there. So let's learn about our certifications. Ms. Page and Josh talked about that a little bit, but to learn, so we have two certifications that are available. There is the internal certification. So as the students are going through the sections, and there's 6 sections, there is an assessment and they need to make 80% or higher. They can always go back within the platform and retest, and the instructor can open that up for them to do that again. Once upon completion, they will receive the internal Ready for Industry certification that is downloadable right there and is actually signed by our Team Kentucky. There's also an opportunity to do an outside industry recognized micro-credential through NOCTI. So that student would go to a NOCTI certified site, or the location to become a NOCTI certified site. Takes literally 10 to 15 minutes. They would take that exam and they would receive that industry recognized micro credential. And then Josh, I'll let you jump in.
Sure. And I wanted to answer your question on different ways that this could be used, right? So whether it's pre-employment, it can be part of the onboarding process to do different sections that Dr. Alvarado just shared. Really on the pipeline, if you're working with I know lots of hospitals and healthcare providers work with their local community to make sure that the students in the region are aware of the opportunities, can be part of the pipeline growth. Michelle mentioned earlier, upskilling your staff or career mobility so they understand the different opportunities and where they can go. And obviously, one of the things we're hoping is that you work with your local regional workforce boards to make sure that they're aware of the opportunity and that you can work in unison and synergize around these courses and helping people. Obviously, the top 5, some of the key industries in Kentucky, healthcare is one of them, and this course is that. Ready for Industry also has logistics, IT, manufacturing, construction, and we'll be doing webinars every week in the following weeks for those. But let's keep talking about healthcare, Casey.
So to give you an introduction to the sections, also to see areas, just like Deputy Commissioner mentioned and Josh mentioned, that you can actually use it as an upskilling tool or as a training-based tool for your new hires, or as they're moving into different positions, because you can take these sections apart. So our first section is delving in, and then this is just a little highlight. There's so much more in here. I would have to take 2 or 3 slides to give you an idea of what that outline looks like. But what is healthcare? The importance of healthcare. So you saw that overview in the video. Then section 2, what is working in healthcare? So we're getting into language terminology that they see, anatomical terms, terms related to conditions and disease. We know that it's a fever, in day-to-day with us, but in medical terms, it's praxia. Looking at medical equipment and what that medical equipment is used for and who is using that medical equipment and the terms related to it. Again, they're getting on the job site. They're aware of not only what they're going to be using, but who they're going to be working with, and nothing is new as far as what they're seeing because they've heard it and become familiar with it. It becomes part of their knowledge.
So throughout Ready for Industry, we have sample questions to check for understanding, where the participants can engage with the questions multiple times to get the questions correct. And additionally, each section has end of section quizzes. So to receive your certificate of completion, you have to show that you understood the content, and that's where that certificate or the NOCTI credential shows the value that this potential hire is bringing to the table. But when you think about the questions that we're asking, what types of care are there? Like, we're introducing the terminology to new people to the field of palliative care, preventive care, right? Looking at the vocabulary in healthcare, such as contusion, making sure people understand what those are, and so they can grow into the industry and feel more comfortable on day one. And then I love question 3 here as a sample. looking at the pathways. How do I get into this industry? What credentials do I need? What continued education do I need to pursue so we can continue to grow the pipeline of participants in healthcare and make sure that we have vibrant resources to keep our communities healthy. So yeah, these are some sample questions from sections 1 and 2. We'll show you some sample questions for some other sections as we continue.
Yeah, so section 3, again, they're stacking on each other. The sections are going in more in depth as the participant is going through the information and through the curriculum. So section 3 is exploring a career pathway. We're looking at what are those career types, so overarching, and then going in depth. What does nursing look like? What does pharmaceuticals look like? What are those diagnostics? What are those EMS? And what does their day-to-day look like? And then section 4 is getting into the current issues. There's things that are trending that are happening in medical care that weren't happening before. There's telemedicine that's happening. There's changes in healthcare cost, insurance questions, and prevention methods that are being used. We saw a lot of those changes over whenever COVID happened. And so they get an in-depth view of current issues that are happening in healthcare. And then section 5 and 6, looking for a career. So now I've had an overview. I know what the day-to-day is. And now I've decided that maybe I want to be that certified medical assistant. Okay, what do I need to do in order to be that certified medical assistant? So I'm looking at education pathways. How do I write a resume? How do I find a job in healthcare? And then preparing for that interview. And what questions I'll be asked. And then section 6 is one that I actually love the most, is, helping the people understand how do we communicate those soft skills, which we know are not very soft. They're hard because they're hard to master and so needed in the day-to-day job. And so employer expectations, working as a team, my goal setting, how I communicate, how I self-manage, showing up on time, all the things that we need and we hear in workforce needs is being addressed in section 6. And then these are the sample questions. Josh, if you'd like to go into those a little bit more.
Sure. I mean, I think the goal here is that this is exposing future employees to the opportunities and getting them excited. So as you're looking at these questions, I want to think about someone that comes to you with this certificate or as part of your training process or internship process. That in that internship, they're not only learning by doing, but they're also going to be able to ask better questions, understand the industry better. And so, what is the amount of consumer agrees to pay, right? Making sure they have the vocabulary down, the characteristics to demonstrate professionalism, looking at those soft skills. We really want to dig into what will make someone more job ready, more successful on day one. And so that's how these courses are designed. And we have Casey, maybe you want to talk about one of our first employers that we're working with in Kentucky that is really using this in the healthcare industry.
Yeah, so we're working with Ballad Health, who has created a health academy for students and CT courses in health science to get their certified medical assistant. So those students will be taking in 9th and 10th grade their health science course, but their RFI will be the curriculum that they will use. Upon completion of that, they will be able to enter into the health academy to do their real world application as well as continue out their courses. And then by their junior or senior year set for their certified medical assistant certification. And when they graduate, they will have a job at Ballad Health to continue that work. And so Ballad Health is in Pikeville, Kentucky, and in some other areas around there and continuing to increase. And so we'll do that in 10 high schools and looking forward to that partnership and what that comes of that.
And that's a model in the high school space, but obviously we also are working with the job centers and employers directly for their programs and their hires. But the point is they see the value in people having the awareness of the space, a better understanding of the space, so they can make good choices.
Yeah, if I speak to another partnership is our Goodwill Industries of Kentucky. Goodwill is training in all of actually the sectors that we're connected to, but in the healthcare area, they're looking at CNAs. And so for 2 to 3 weeks, they will actually have their trainees take the RFI curriculum and they will pay them. to finish out that curriculum. Upon completion, they'll enter into the job training portal to work for that CNA career. And so there will be some CNAs available for you, and Goodwill's looking for those partners with employers to provide you those ready trainees. Okay. This here's our information about our Kentucky workforce data. We can see that 20.8% overall in healthcare is the growth that is happening there, but there's some other areas of different pathways, sort of the medical assistant and home health aides that have substantial growth and substantial need and demand that is happening there. Mr. Bill, if you don't mind to give them some more information about what's the growth and what's the need happening there.
Yeah, and I think we all know that the healthcare industry is such a important part of our economy and just our lives in general. And the need for individuals in the healthcare industry is just going to continue to grow, especially as the boomer generation is now starting to retire, and they get older. There's going to be a much bigger need for them, and so this need is going to continue to grow, and we're going to need more and more people. And as you see there with that 16% turnover rate, turnover in the healthcare industry is a huge issue. And one of the reasons why the state of Kentucky has invested in this program here is because if we can prepare people to understand what they're getting into when they get a job in the healthcare industry as best we can, that can better to lessen those some of that turnover. Because if they know, oh, okay, I'm going to have to do all this and that and the other and all these different things, they know what they're getting into. And so somebody may have a desire to be in the healthcare industry, but they don't really know exactly what that means. And by going through a program like this, they can at least have a better idea. So they can say, oh, okay, maybe this isn't for me, or maybe certain aspects of the healthcare industry is something that they, would be better at. If they can't really handle blood, then being a phlebotomist or being, a nurse is probably not something they could do. But there's physical therapy, there's all different kind of other jobs that are potentially available where they could still be involved in the healthcare industry. And so we all know that the need is there, and we're doing what best we can to try to help our healthcare facilities here to be able to handle that need.
Thank you so much, Bill. You hit the nail on the head. Is reducing the risk, and giving them time to do some career exploration, as well as when it comes to using it to upskill or to onboard. You could reduce your onboarding time, and you could reduce maybe your turnover rates using this type of curriculum. So this is just a picture of your internal certificate that we talked about, the RFI certificate. And then the next one just gives you an idea of what that NOCTI looks like, so you can identify that. And I can send those at any time so that you can see those and be identifying those individuals that come to you and have the certification. Josh, if you could tell us a little more about this, the NOCTI certification.
Sure. The NOCTI certification is the sort of a gold seal, a gold standard for, verifying that the knowledge has been acquired through the course. And so this is the breakdown of the content that is covered in the NOCTI certification. Many employers know of NOCTI. It's a national credentialing organization. But if you haven't heard of it, you should feel trusted that when a potential hire comes to you and says, I have a NOCTI certification for Ready for Industry, that they have gained the knowledge in the course and that they are that much more ready for healthcare on day one. And so, we're excited about the opportunity for this and excited to work with employers to encourage this as a way of demonstrating that day one readiness.
Is there any questions thus far on NOCTI certifications or anything else? Okay. So throughout, RFI is not only in Kentucky, but we're also in some other states and Tennessee, Louisiana, and Alabama, and we have partnered across with various organizations for RFI to be used in school systems, correctional facilities, rehabilitation services, training services, workforce development centers. It's very flexible. Again, and it's self-paced, and it's an amount of time, but a small amount of time, 15 to 20 hours for each section. And many employers see the value of it and what it's bringing to their organization. And so these are some of the partners that we have.
Yeah, I would just add that, another Coosa Valley Medical Center, as well as Huntsville Hospital, so that's in Alabama, are using this with their, to try and prime the pipeline of talent that comes into their centers.
All right. And so finally, it's as we're so thankful that you were able to take this time and be a part of this webinar and learn what RFI is, and hopefully be able to use it in your organization, as well as be with partnering organizations. So maybe there's some training centers or workforce development organizations that can help you, again, to help you with your pipeline, to increase some skilled trainees who are ready on day one, to reduce your onboarding time, to reduce your issues of retaining, and be able to help you get that skilled person that you need from day one. And so our ask from you is, one, launch a pilot at your location. Very easy to do. You can scan the QR code today, as well as my contact information is below. The training is very minimal, 30 minutes. I can show you what to do and how this platform works, and to create that and implement that into your organization. And we come alongside you with us, our support team, to help you with day-to-day. So there's no hiccups, and that it's a seamless process. The second piece is spread the word. Invite your local high schools, invite your agencies, invite the boards that you sit on and the people that you're connected with to take advantage of this opportunity. It's fully funded by Team Kentucky, and to be able to create a more ready workforce. And the last piece is share your feedback. Share your feedback with your local workforce development board. Send them an email today. Send that workforce development board member a text and let them know that this program is there, that you want to be able to implement it in your region and in your workforce development centers in order to get the skilled trainings that you need in your workforce today. And at this time, I'm going to turn it over to Team Kentucky.
All right. Thank you again, Dr. Alvarado and Josh. On behalf of Team Kentucky, I wholeheartedly encourage employers on this webinar to explore the Ready for Industry program. It's a time for call for action, how Ready for Industry can play an essential role in your workforce development strategy and goals. Together, we can build a more skilled healthcare workforce in Kentucky. We heard you, and we're providing Ready for Industry for employers. The team here would love to reach out to you. Please connect with the email and the QR code after the presentation. Thank you again for your time and dedication. I'm confident by partnering with Ready for Industry, we can collectively address your workforce challenge and then continue to provide exceptional healthcare of Kentucky. I have complete faith in your ability to overcome these challenges, and we're looking forward to seeing how you do in implementing Ready for Industry. I'm going to open the floor to the other panelists. If Deputy Director Dennison from the Kentucky Workforce Innovation Board, did you want to add anything to today's presentation?
The presentation was awesome. Thank you all very much. I think just a note that the state is excited about offering this opportunity, and the more engagement that we have with it, exploring, upskilling the opportunities that they've discussed. I think that we all can have that workforce ready in healthcare, ready to encounter the upcoming needs, as Bill mentioned so eloquently. So looking forward to supporting any questions that you have at a state level or along the way. Appreciate the time today.
Awesome. And from the local workforce development area perspective, Bill, anything to add? No,
just again, as every healthcare professional in every hospital that I talk to, it's always the same thing: is that we need people. We suffer from retention issues, and And this is why the state of Kentucky is investing in programs like this, because we're trying to do what we can to help prepare, the population for these types of important industries like healthcare. It's such a huge part of our economy. It's usually the largest workforce in the local counties. The biggest employer is the local hospital, and again, a lot of people may be interested in working at a hospital, but they have no idea what that means. They have no idea of the wide variety of opportunities at the hospital. Everybody knows what a nurse or a doctor is, but there are so many different occupations that work at a hospital, from even just maintenance people and administration, as well as all the different various healthcare roles that are available there. And providing a program like Ready for Industry, it helps individuals to understand just a lot of the different various aspects and different various occupation opportunities that could be available to them, and to help narrow down what somebody would like. Because if we can help individuals to be able to understand what specific niche, of things that they may like, or somebody who's already in who may not understand all the different opportunities, it can help to get people where they would best fit. And if somebody's at the place where they best fit, that would increase retention, increase job satisfaction, and then provide more effective employees, and improve our industries.
Bill, can I ask, should employers that are interested, that see this webinar today live or on a recording, should they how do they, or what should they communicate with their local boards?
If they're interested in participating in this program, they can reach out to either myself or our email address is workforce@ky.gov, and we can get them. If they are not connected with their local workforce board, we'd be more than happy to direct them to that. So I'll show that in the chat. Workforce@ky.gov. It's a statewide email for our office, and we'd be more than happy to assist that and to get our industries connected with their workforce board if they're not yet.
I just had a little light bulb moment, and it's maybe we've been talking about it the whole time, but like, so many people visit healthcare centers because they have healthcare needs, but they also might be in job transition mode or looking for work or what have you. So even a Ready for Industry flyer on your wall saying, looking for you want to get a head start, take this. It is available to every Kentuckian who would like to learn more about the industry. So, but I also think we can work with medical centers, hospitals, home hospice, you name it. If you want to connect with us so we can train your staff on how to launch this and support that to make it easier for you, that's our job. That's our role. That's our goal. And so please reach out. We'll put the email, Casey and I will put our emails in the chat box. So if you have any desire to get started with Ready for Industry, we're right here waiting for you.
Yeah, no, that was definitely we had the same thoughts. So if you wanted a flyer specifically for your organization that we could set up, a QR code that we could offer you, or any other kind of support, and then we can also train your teams. All of these things are available. And so I'm entering right now my email address and then also my Calendly. So you can just click on that link and set up a time with me. And then we can discuss further how we can take this for your organization.
Jump in here if that's okay.
Yeah, please.
Lisa Page from the Office of Employer and Apprenticeship Services. A couple things that I just would like to reiterate today. The importance employers to really take a look at the course modules and the information behind those course modules and what's included, because it is such a helpful tool to see that, because this certification or certificate can communicate what someone knows very clearly. And it's so important that you know what's behind, the Ready for Industry healthcare certificate. I think that that's very important. So you know that when someone comes in, and also mentioned this before, as part of that credential framework and the stackability of credentials, and Ready for Industry really preparing individuals for a career in healthcare. As the director for apprenticeship services, of course, I'm going to plug apprenticeships, but this is a great tool to help in that pre-apprenticeship phase of apprenticeship programs. And as we all know, apprenticeship is the best gold standard model of work-based learning, and this can be the first step into a healthcare pathway. So just wanted to mention that and really take a look at the course modules for Ready for Industry's healthcare sector. I think you'll be very surprised, pleasantly surprised at what somebody will get to know. So thank you.
Thank you, Lisa, for that. And after this webinar ends, I will get all those course outlines to those people that registered.
So I will end today with a thank you for taking your time to meet with us to learn about Ready for Industry. I think Dr. Alvarado and Josh, please connect. I'm confident that partnering with Ready for Industry, it'll help you in reaching your workforce goals. Thank you again.
Thank you, guys. Thank you, Team Kentucky.